Thank you all for being with us, and welcome to the 11th Canadian Council for the Americas webinar during these COVID times, and specifically the second one exclusively on Peru. For those who haven't been with us for our previous events, we welcome you to visit our website to access the recordings at ccacanada.com. And you can also listen to CCA's podcast, Two Gringos with Questions there. It's co-hosted by Chris Sabatini from Chatham House in London. And recent interviewees include Francis Fukuyama, former New Zealand President Helen Clark, Colombian Mexican-American filmmaker Rodrigo Garcia, as well as Daniel Coronel, the president of Univision News. So I invite you to check those out as well. Before introducing our illustrious speakers today, would like to give a special thank you to the Ambassador Ralph Jansen and his team at the Canadian Embassy in Peru. And of course, a very special thank you to CCA's annual premium members, without whom we wouldn't be able to be doing these events. So moving on to today's panel, our speakers today are Dan Collyns, a reporter for The Guardian in Peru, Dr. Patricia Garcia, former health minister and professor at the School of Public Health at Cayetano Heredia University, María Isabel León, president of the National Confederation of Private Business Associations, otherwise known as CONFIEP, and Eduardo Recoba, economic correspondent for Latin America at iForex Financial News. So with that, I will hand it over to Ken, your illustrious moderator, the president of the CCA. Thanks, everyone.
Thank you, Marta. I don't know how illustrious, but I'm very happy again to be here for our 11th event. And we got up to a start a couple minutes late, so I want to move right away into the substance of this event. Several of the panelists definitely have a hard stop on the hour, and we will respect that this time. So we're trying to get through a lot of issues quickly. I want to first talk to Patricia Garcia. Patricia, you were with us on the first event we did on Peru probably about a month ago, and at that time Peru was right up there leading in tests that were given to its citizens. It was early on the quarantine. It was following the WHO guidelines. Things seemed to be cautiously manageable or being managed. There was no talk at that point of reopening the economy, but now we're at a different stage, and not only has there been talk of reopening the economy, but there have been some steps in that direction. But before we get to exactly those steps, can you talk a little bit about what now is the status of COVID and the basic facts in Peru, and why, as part of that question, why have we seen all of a sudden a huge bounce, or would appear to be a huge bounce in the number of cases being detected? Patricia?
Well, thank you so much. And this gives me the opportunity of commenting on something that is not being seen, especially in the news when I read things outside of Peru. I mean, it looks like really terrible, but this is an opportunity of telling you what I think is happening. So Peru started on March 6th with the first case, and very soon we started taking measures, very severe measures, like the lockdown, as I mentioned the last time, and curfews, etc. But one thing that was seen also very early during the epidemic was the fact that people were not following the curfew, or were not following the lockdown as we wanted them to do it. One of the things to show you that is the fact that at some point during the epidemic, what we were having more people in the police stations than people infected, okay? So although we had the lockdown and the curfew, people were not following necessarily all the measures that happened. However, I have to tell you that my vision is much more positive. I think although the quarantine and the measures were not probably perfect, we were definitely able to really push down the curve. So I don't think we're having a blip, okay? What happened is that we have not been able to push it as much as we would have liked to do it. But we push it down and we slow down also the number of cases, which allowed us to really move from 100 ICU beds and ventilators to around 1,000 at this point. And it's giving us still some time, because we have right now engineers and physicists and scientists here in Peru working on the production on new ventilators that will allow us, I think, to help us in the next days with the management of the patients that we need. One very interesting thing that Peru did, which other countries didn't, was the fact that we recognize the weaknesses of the health center, of the health services. We recognize informality and how people are, we know that people are not used to follow rules, and we know that we have certain social norms that make us have like extended families and people trying to still go, although they are not supposed to visit the family, etc. Right? So we realize those things, and we realize also our poor capacities to do molecular testing. So very early in the epidemic, when nobody was thinking about serologic tests, Peru got these 1.5 million serologic tests, okay, that got here in Peru very early. And the thing is that we had the experience of using rapid tests for malaria, for dengue, and recently, or relatively recently, for syphilis. So we knew about the tests, and immediately we validated the tests, and we started increasing our capacity for doing tests, but with molecular, but with serologic tests, not molecular tests. So by yesterday, we have 840,000 samples, people that have been tested, okay? And most of those tests are not molecular tests, are just serologic tests. So that's one. The second thing is that we have been doing tests not only on symptomatic people, on people that are having symptoms, no, and not only on contacts. We have been doing testing on almost everybody. I mean, trying to find populations that we think that might be at high risk, or just to allow police to feel more comfortable because they were scared. So as a way of calming down, we have been doing testing. So we have been doing so many tests that in comparison, when you compare us with other countries, and this is something that, I mean, I was seeing, for example, the site that Oxford University has a site, and they have not understand at all what is going on in Peru, because they are, when they put tests, they don't have the right tests, and they are not considering the fact that while other countries are only doing molecular testing, and while WHO considers that a confirmed case is somebody who is symptomatic or a close contact with a molecular test, what we are reporting is we are reporting lots of things all together, which are symptomatic, asymptomatic, and population cases. So in other words, when you compare what is going on in Peru with other countries, what we are showing, other countries are showing the point of the iceberg, the tip of the iceberg, and what we are showing is the tip plus part of the basis, okay? So I think the comparison is not fair. Having said that, which is, I think it's a very important point, because the fact that the government is not able to explain this to the population, that people are seeing our numbers, and I mean, has created in most of the people, and economists trying to push the economy to be open, okay? So all those things, I think, have created within the population also this feeling of, we have done terrible, so why should we kept our quarantine? So I think the population is divided in three groups, okay? The ones that really believe that they have the means of staying at home, so they will not move there. The ones that are in the middle, considering that we have 70% of people that are informal, that need to go to the streets in order to get the money that they need to eat, etc. So the ones that are in the middle, I said, I can make an extra effort maybe to try to keep my health. and the ones that don't care at all or don't understand what is going on. For these ones, it has been very hard. But when we start having all these numbers that are terrible, or these messages that are terrible, the government is not able to really explain, because it's a difficult thing to explain, okay? So some of these people that are in the middle start going out, okay? And I think that's really bad. So that's another thing. I think social communication has not been that good, and that's disincentivizing some people to stay home, which is a problem. You have to add to that, of course, what I was saying. I mean, we have informality, and there had been, although we do have this fiscal cushion and there had been bonuses to people, the system has not worked that well. And that had to do with our incapacity of identifying all the people, with our incapacity to be able to bring the money where they are. I mean, we don't have a good system like Rwanda, for example, to use cell phones to transfer money, okay? And that's something that needs to be developed here in the country, okay? And so people had been going to the banks. Maybe that could have been one area of infection. I don't know. The interesting thing is that the people who had been working in the banks had not gotten infected at all. Well, maybe the conglomerates and a lot of people were outside the bank, and that was a problem.
Patricia, if I could interrupt for 1 second, based on going just back to the epidemiological, the numbers and the converse and your explanation, just based on that, what is you said it's not as bad as some people have made it out to be, and you explained very articulately why. But based on all of that right now, if someone were to ask just one specific question, so what is the trajectory, your projected trajectory of the disease, of the virus in Peru, assuming reasonable compliance by the ciudadanía with social distancing and staying home except where not necessary. With those assumptions, what should we be seeing in Peru over the next month or so?
Okay, so what we are seeing right now is we're in a plateau going down. Okay. But this is, so definitely, the problem is that I would have liked to expect just a peak, okay? But instead of a peak, what we are seeing is a plateau, and right now it's coming down. It's coming down in the number of new infections, and it's coming down in the number of deaths, okay, that we're having. But this is the average, okay? And so this average is being pulled by the numbers in Lima. So in Peru right now, we not only have one epidemic, okay? Lima is 1/3 of the population, is the big thing. What we are having is multiple populations, multiple epidemics, because what we are seeing is that still we have certain areas in the northern part of Peru and in the jungle that are still, I mean, it looks like they are starting to flatten a little bit, okay? My concern, and this is something that I have to tell you, is that my concern is, I hope that I can see I mean, we're seeing the numbers every day. It looks like definitely it's going down. But my concern is that there had been one action which has been detrimental, complicated, bad around the past 2 weeks. And that was the exodus of migrants, of people from Lima to the rural areas, okay? And the thing is that although I was talking to you about the serologic tests, which had been great for access, the problem is that the use that is being, the use of the serologic tests and the interpretation of the serologic tests, it's not adequate. And what has happened is that although, for example, on some of these people that were taken by, sometimes by people with good hearts that were trying to help them because they couldn't support themselves in Lima and they wanted to go to rural areas. Some others were taken by mayors or politicians that were trying to get some votes or get some sympathies, okay? Right. So some of these people were tested, okay? And supposedly because the test was negative, they could go to the rural area and go to their towns. And the things they were ignoring the fact that the test is not a certificate of health, and it's not a passport for immunity at all.
Right,
so it doesn't work that well. Plus, there were people, instead of doing what they were supposed to be done, so these people should have stayed in a quarantine for 14 days, they are going to these rural areas, and my fear is that we are going to start having this, I hope they will be small, okay, outbreaks in certain areas far away. So we're having that problem. The other problem that we have is that people started to realize that we have indigenous communities that probably could be at risk. And instead of just leaving them there, the introduction of, again, politicians or the church bringing them things, etc., have started some outbreaks in these communities.
Okay, Patricia, so, this is perfect.
And this is my last comment, okay, yeah. regarding the economy. So right now, I think the only thing that I'm glad is that a couple of days ago, the president, what he said, he didn't use the word opening the lockdown. He didn't use that word, okay, or stopping the quarantine, which was great. The problem is that he was so confusing, okay. I know that it's a difficult way of saying it, but what he has done is we have gone into this new phase of living, okay? But I think social communication is lacking. So we're supposed to start some economic activities, but still my problem is that I feel that we have the people that are going to stay in quarantine, they're going to be fine. The middle ones that are kind of demotivated, depressed, they need to go out. And because everybody's talking about how the numbers are going up and nothing works, even the congressmen are talking about that, okay? So they are trying to go out, and the people that don't understand what is going on, I think the risk is that this plateau may become our new baseline and we could start going up. And that will be really terrible at this point. That's it.
No, fantastic, Patricia. I wanted your last comment was a perfect segue to bring Dan into this conversation. And obviously, we definitely want to talk to Eduardo about the economic damage done to the damage done to the economy through this and the medidas, and then obviously get to Maria Isabel for the view from not just the pymes but the large companies and their views and contributions to the national discussion about when to reopen. But I want to go to Dan right away because Dan, I'm sure you've been listening to this. Patricia talked about what's going on, not just in Lima, but outside of Lima. And there's nobody who's done better reporting that I know of on what's going on and in the indigenous communities and the effects outside than you have. So do you want to talk a little bit about what you've seen anywhere in Peru, Lima if you want, but particularly what you've seen on what's going on outside of Lima, the attitudes, the concerns. Patricia even talked about the Amazon. You've done reporting on that as well. Do you want to talk about any of those issues, please? Do we have Dan on? Hello, Dan.
Can you hear me now?
Okay, now we have you. Great. Yes.
Okay, great. Yeah, thank you so much. And thank you so much for the invitation to speak to you at the Canadian Council of Americas. I think, as I think the President, Vizcarra, said on Friday, that Peru's a heterogeneous country. He was talking about how there's so many sort of cultures in one single place. And as Dr. Garcia pointed out, there have been outbreaks in the north of the country and in the Amazon regions, and particularly in the Quitos, which has probably now peaked and is probably starting to decline in terms of cases. But it has been particularly bad there. We're now seeing in Pucallpa, which is another Amazon city, that it's getting very bad there. And of course, we've seen on the northern coast of the country, in Piura, Lambayeque, those regions have been also very badly affected. And I think, there's some factors which inevitably are going to make them hotspots for COVID-19. They're hot. People spend more time outside. There's poor sanitation largely. Social distancing did not really take place. I mean, the lockdown was largely flouted in those areas. And of course, you also have poverty, which is a major factor. So people literally have to go out on the streets to earn a living, to earn enough to eat on that particular day. They can't stay inside. And we've heard of some pretty astounding statistics coming from places like the El Mercado Belén, the Belén market in Iquitos, where something more than 90% of the traders were found to be infected with COVID-19. And that's not actually that different from statistics that we saw in Peru a couple of weeks ago, where in the main wholesale fruit market, more than 80% of traders were found to have COVID-19, and most of them were asymptomatic, which of course is particularly problematic because of course these places are becoming vectors for the spread of the infection. I think the stage we're in now is one, as Dr. Garcia mentioned, I think the message that Vizcarra gave on Friday, in which he was extending the lockdown, but it was not in such clear terms as it had been made in the past. And now we're seeing that people have been more active. Just over the weekend, more people were out on the streets. And yesterday in the Gamara market, which is the hub of the textile industry in Lima, and where also there's a lot of sales of textiles, and it's a hub of employment for hundreds of thousands of people, particularly from poorer sectors of the capital. It was almost like there wasn't a lockdown at all. The streets were full. People were, even though the mayor of La Victoria, which is the district in which Gamara is, George Forsyth, who's a very popular mayor, in fact, a young man who's a former goalkeeper for Alianza Lima, which is the football club which is supported in that particular part of Lima. So he's a popular mayor, but people were saying, we can't stay at home any longer. We have to feed our children. We have to be on the streets. And I think, as it's been mentioned before, you have these incredible statistics in Peru, which almost run counter to its macroeconomic statistics as one of the healthiest economies in Latin America. We have more than 70% of informality and something like 40% of workers who are classed as independent workers. And that may sound like they're entrepreneurs, but in many cases, they're probably taxi drivers. And so you have people who need to work from day to day. And I think it's getting to the stage now where it's going to be very hard to enforce this lockdown because there are now, there is a gradual opening up and people are less willing, especially in those more needy sectors, to respect the lockdown. I think now we're going to see, as public transport starts operating a little bit more, perhaps often illegally or illicitly, we're going to see that buses and minibuses and probably even the Metropolitano, which is a dedicated bus service which runs down sort of the spine of Lima, that's now going to become a vector for COVID-19. And I think it's going to be extremely difficult for the authorities to control. I think probably what we're going to start seeing gradually is some social unrest. What we've seen in Ecuador yesterday, for example, there were protests across the country. Now, perhaps that's a country that has not, I think it's definitely a country which hasn't handled this pandemic the way that Peru has. And I mean, I think Peru's handling of this pandemic has pretty much been as good as it could possibly do, given the weak institutions that it has and a chronically underfunded healthcare system going back decades. What Vizcarra did in announcing an early lockdown was absolutely the right thing. But now we're now day 70 or past day 70 of lockdown, and it's going to become particularly difficult, I think, to maintain it.
Thank you very much, Dan. Your comments are perfect transition from what Patricia said, and a perfect transition to where we want to go to now. We want to actually focus a little bit on those economic issues and the damage that's been done to the economy, and particularly also the kinds of concerns that the companies and the businesses have about their own sustainability and what a reopening might look like.
I'd like to talk with María ahead, but for a minute, Eduardo, can you give us a summary, more or less, of the damage on the Peruvian economy through the quarantine and the basic guidelines to reopen that have been announced by the government. Eduardo, can you tell us briefly about that? And then we'll move on to Isabel. Yes, of course. Ken, thank you, first of all, for your invitation. I understand that I can talk in Spanish, whatever you prefer. Spanglish, a bit of everything. That's why I asked you in Spanish. I believe that another webinar, we discussed what's going to happen this year, and that this was compared to a Western movie. We started with a bad quarter, an ugly quarter, and a third quarter that would be kind of good. So the first quarter, I would say the fourth quarter would be like an intrigue. So Juan, you don't have Clint Eastwood yet? No, we don't have Clint here for the good, bad, and ugly. The first quarter has been very bad. We decreased 3.4%. I think that this decrease perhaps is one of the strongest nationwide and in Latin America. I worry with a GDP that is not in the season, or perhaps without being in the season. Remember, we're talking about a drop in 23%, and that is a big blow because, remember, there's a difference between the demand and consumption. We have the demand has dropped 45% from March to date. You can see this decrease of the GDP. What's very curious in the last 12 months is that we do have a bit of a growth. But going back to the context, the blow in macroeconomic terms has been very strong. It's been sound. It's not reflecting really the policies or the batteries or fiscal batteries implemented by the government. It's not registering a response from the demand or a response from consumption or a response from employment. So it's really a statistic headache for economists, for analysts as well, because for now, again, we have to look at that way of increasing consumption, but that drive, I'm sorry for using this term, hacking a bit, the fact that the curve, the plateau is dropping. So to prioritize the economy versus healthcare, or first healthcare, then economy. And perhaps another indicator that's interesting is, by the way, these fiscal batteries, we have seen two programs, major programs. One is called Reactiva Peru, a program which has to do with the GDP of Peru, that intends to be from 12 to 17% of GDP, which is powerful in Latin America. But this program is very slow. So it really provides very little to activate employments. And the second major program in Peru is a bit smaller, fiscal solvency. It's called FI. And it's for the micro companies or the SMEs. It's a program which is not as swift as, or the pace expected by everybody and all the analysts and economists want. So it is a nightmare. So is it the economy? Is it healthcare? There it is. There we are. Okay, thank you, Eduardo. So I'd like to introduce Maria Isabel to this discussion. Thank you so much for your patience and the headaches that you must have daily on this issue. Could you briefly tell us about your concerns, your major concerns about this quarantine, and also your concerns on reopening or not reopening the economy? Indeed, early on, the enterprises in Colombia were hit, in Peru were hit very hard, not only in Peru really, but worldwide. And it brought with us a mandatory quarantine, initially of 15 days. And so we started off with taking care of the people, of course, because if you don't have healthy people or available, you cannot have employers or employees. So that was the first thing we started off with. Now we're on day 72 of the quarantine, with the exception of some basic activities in the economy that have kept on from early on. We're very concerned with the global projections that say that 2020 will have a contraction growth rates of -3%, and in Latin America it will be 5%. It will be higher. So this is an enormous bad thing for our economy. The recession of the 30s really is something that we think of a lot. So there's a global vision that many companies will be closing because of this paralyzation. And there's no assurance, for instance, because there are many products that won't be produced. And of course, that will break a lot of supply chains. It's calculated that we're talking about more than 48 million companies that will be closing. And we're talking about 240,000 people that, as of March 6th, have lost their job in Peru. So, but this is more related to the formal sector. We're talking about 17 million people that work in the formal sector in Peru. However, 73%, about 12 million people, work in Peru in the informal sector. And this also shows the government's weakness towards this informal sector. With the mandatory quarantines that have been expanded till June 30th, we have an enormous impact on keeping companies and employments. And the blow has been basically on the SMEs, the micro companies. Larger companies have an impact on the medium and small companies as well, especially unemployment as well. So in this case, the question that we are asking ourselves in this 72nd day of quarantine, now that we're facing this global pandemic that has hit Peru, yes, hard. Yes, the impact is huge because we have 0.3% affected, yes, of the full population, but still. So it seems that we're just blowing up the figures. But how can we take care of the economy, taking care of the health of people? Those are circumstances that now we have to focus on this quarantine. Because although we have to take care of people's, Peruvians' health, we have to look at the economy. And the government has made subsidies, created subsidies for people of low income, especially of the informal sector. But these people are people who have to stay home, but they have to live and survive on the streets. And really, I think that our initiatives in Peru have been audacious, have been great compared to others in the region. So this pandemic comes to Peru when we have a solid, sound economy compared to other countries in the region. So we do have the capability of having more depth and everything, but it leads us to think on two factors. How can we help people to be fed during this quarantine that's expanded? Now that's taking so long, as Eduardo said, we know initiatives are well intended of the government, but the money and the subsidies are taking too long to reach the proper hands. And on the other hand, we have another line in Peru, Reactiva Peru, which has given out 76 million soles to the companies, medium companies and small companies can cover their payrolls and everything. But this is also taking a long time to reach proper hands. So here we have a situation that we have to begin to think of how to reopen. Of course, the economy has to start to begin to operate. The government has said that as of May 24th, we can start a phase of reopening. This is something that is good, yes. However, the idea here is not to point fingers, but we have to do things together. The opening of the economy has to be made convinced that we have to meet protocols, safety measures. There's no doubt. The formulas that we have to use for the economic development must go hand in hand with these measures. But all of these protocols and efforts made by the government are only aimed or targeting the formal sector. The informal sector instead is the one that has people have to go out to the streets to survive. So we see terrible pictures where there are a bunch of people selling their products on the street, and the markets, farm markets, are also spreading areas of this virus. So we have to also look at the most populated areas of Lima to look at where there's a higher rate of spread, and internationally as well. There's no balanced distribution of this pandemic. We can see that this is something that we see focalized in different areas. So we have to study the situation, to see how we can reactivate these sectors, especially the ones informally, making people aware, because people are not aware and do not believe the use of washing their hands and wearing the face mask is important. Then it's very important to keep people safe, so we're really facing a very concerning situation, and we cannot continue the same situation. We have to reactivate the economy, taking care of health, but everybody has to pitch in. Thank you, María Isabel. So following your comments, if I understood you well, you believe that the measures to reopen of the government have been a bit shy, at least in the formal sector. So what should the government do to be more aggressive, but at the same time, to be seeking to increase the health of the people, public health? Are there any measures that you believe that should be implemented? Yes, what happens is that the measures are basically for the formal sector. We have a reopening setting that's made in 4 phases. The first one, it took longer because of the bureaucracy involved, because of the protocols and safety measures that companies needed to meet. And this has taken more time than expected. So you could say that there are different sectors of the economy that say that by August, they're going to take to be able to have these safety measures that are so stringent. Remember, the government has said that it gives subsidies depending on the volume sales of the companies. So that's a big problem as well, again. So all the protocols, all the measures for the formal sector, which cannot start its activities because of stringent protocols. So when I look at the Gamarra, this is a big area with the shopping center. It really gives me the chills to see the shopping center opened now, although they have strict protocols and everything. It really is the shop owner, the one that should, that really should take care of the number of people coming in. The idea is just to meet these safety measures and keep in mind the people's safety. Also, we have to look at what we need to do so that the formal sector can teach the informal sector all the protocols in a simple manner. The idea is to be aware, everybody, that if we don't work together and we get out of this situation together, we'll have a vicious cycle that's very, very dangerous for the country. Thank you, María Isabel. I think that all the panelists would like to talk about that as well. But let's begin. Let's go back to Patricia.
Patricia, if I'm seeing correctly, you seem to be nodding in agreement with a lot of what María Isabel was saying, and quite often public health officials and epidemiologists, understandably, are more cautious about reopening and the balance of losing the gains already made in trying to protect public health. Do you want to comment a little bit on that balance going on by the government now, and whether or not you think the government could be more aggressive in opening up at the same time protecting public health in the way it needs to be protected?
Yeah. I mean, I was nodding because I completely agree with María Isabel about the fact that there had been measures that are that are, for me, extreme in the case of the formal sector, and almost nothing referred to the informal sector. So I completely agree on that. I'm one of the people that had been, I mean, I'm kind of advising the Ministry of Health, okay? But however, this advising role doesn't mean that they follow all the things that you mentioned or you said, okay? Or you complain about. And one of the things that I think had been crazy is all the bureaucracy that had been behind all those protocols that they pretend all the formal sector to follow. And I think they are based, several of the things that they are asking are not based on evidence. So even the use of rapid tests, frequency of rapid tests, there are so many things that I think had been absurd, okay? So in that sense, I completely agree with María Isabel. I think they are making their lives much more complicated. It's more expensive. However, I'm not sure about, for example, opening big malls, commercial malls. I'm not sure about that at all. And but I agree completely with her about and with Eduardo also, that one of the issues that is happening with the government is that we are moving very slow and in a very bureaucratic way. And that is not helping for the economy, and it's not helping either all the issues that we are doing in health, okay? The second comment that I would like to do is in the informal sector. There are areas that have not been, unfortunately, targeted the way they should have. And there have been 70 days. And from the very beginning, we have been complaining about the issues about the markets. We have been complaining about the issues of what is going to happen with public transportation. And now we're opening public transportation, and we are seeing that it is a big issue. So I think those two big, so what to do with the informal sector and how to handle markets in general and public transportation is something that has been left. And I feel that the government has been trying to focus on the things that are already working in some way well. I mean, if you see the supermarkets, for example, I mean, they have been taking care of several issues about, I mean, protocols of protection that are doing very well. but the government still making more protocols to them. But the issues that we should be paying more attention, like the regular markets or public transportation, had not been managed. And again, I just want to strengthen another point, okay, is social communication. I think the media has been doing a pretty good job, okay, television and newspapers in general, trying to promote practices, good practices. But I haven't seen really, except for the fact that the president is talking every day at noon, I haven't seen a real formal campaign about how to do this. And so I think that's what we are lacking. I think actions regarding the informal sector, and bureaucracy and the speed of the responses are things that we are failing really in Peru to do in the right way.
Thank you, Patricia.
Thank you, Patricia. I would like to go back to Eduardo. Eduardo, Maria Isabel had a lot to say, very interesting. Patricia with her answer as well. What do you think about the balance of the measures, the economic measures taken by the government, and the desire to protect public health? I mean, what do you think about all that? Eduardo? Are you on mute? Yes, undoubtedly. I think that we're all aligned with the fact that the government is perhaps creating, I don't know if bottlenecks, but basically from the fiscal to the real economy. But as María Isabel said, we're pointing fingers at A, B, C, and D, but it's really a structural problem. The informal sector came here since we were a Spanish colony to date. So we're talking about a sector very historical, very part of our culture. So what's the balance between the government's measures and what's happening now? There are confusions. The subsidies are very slow. The assignment of the budgets are, because of the barriers and the bureaucracy, are taking longer in the process. There are basically, we have here from the authorities to provide the money without being fiscalized. And of course, all the scheme related to the public management deficit or public expense goes hand in hand. And I think that this completes what Patricia María Isabel just said, and what Dan described so well before. It goes hand in hand with a lack of knowledge and a lack of reading and of measurement of our informal sector. We know very little about the informal sector. We can identify some numbers, like Patricia has said. We have identified some samples, but when it comes to that reading, that basic reading, it's valid, yes. When it comes to that, there's another reality that's much more related to a lack of knowledge of how that sector really acts, how it has an impact on the economy, and what's its impact on the GDP. So that makes me think that the government is far from knowing about that reality. And of course, the measures from fiscal effects like Reactiva Peru, like Heredia, which are two major programs of the government. And there's a third one that's a bit smaller and even slower. I mean, these fiscal activities reflect on, and I'm sorry to say this, the government, from its cash flow, has taken out less than 1% of the GDP. So if people understand this, from its pocket, it's only taken less 1% of the GDP. However, it's fallen back in payments of insurance for unemployment. It's hurt the pensions. This represents 3 to 9% of the GDP. So again, we see that this bottleneck in which the government should be focusing on is not creating not only the swiftness, but the powerful expense that it has been acknowledging it's been doing. The government has spent less than 1% of its wallet, and instead it has fallen back on its payments on private and also in other tools. So that says that the government is, as you said, shy. So on the one hand, we have a government that's shy with little knowledge of the informal sector. And on the other side, there's corruption so that we can stop the spread and we can start to decrease the curve and to begin really on a long-term basis how to have a better education, healthcare, and cultural sector, which are problems that structurally today are hurting the situation, of course. What will come later is I'm an optimist like Patricia, and the economy, there will be a rebound. I feel that in the fourth semester or in the first of this year or the first semester of not only the economy, but to drop the figures. So the first semester we'll have John Wayne for the Western. Yeah, sure. Thank you so much, Eduardo. It should. Yeah, the cavalry, you mean. Yeah, let's see. Thank you so much, Eduardo.
Mil gracias, Eduardo. I want to go to Danielle and then finish up with Patricia. We're not quite over an hour because we started late, so I'm going to abuse everybody's time for a couple more minutes, but not much more than a couple minutes. Dan, there are a lot of balls in the air right now. There's the economic pressure. There's the idea that maybe the government's being too timid with the reopening, or maybe all the criticisms that we've been listening to about how the government has not been handling it, certain things certain way. At the same time, there have been a lot of complimentary comments about many things they have gotten right. You talked about the observance of the quarantena outside of Lima being lax, not necessarily because people want to abuse it, just because they need to be doing working in the marketplace, which is not an uncommon story that we've heard throughout Latin America in the course of doing these 11 events and more up and coming.
Sure. Absolutely.
How does this play out? How does this play out over the next month? I mean, the president is so far enjoyed a fairly high approval, extremely high approval rating so far. Is the populace in the body politic still ready to stay with him on this? What's your sense of how this is playing out socially and politically?
Well, Ken, I mean, as you said, there's a lot of balls in the air, and Vizcarra has enjoyed very high popularity. I mean, he was in the upward of 80% last month. That I don't think that's going to hold. That he won't be able to maintain that popularity, as you know, there's so many things he has to deal with. And I think that I agree with a lot of the points made by the other panelists, including Eduardo, who mentioned, you know, trying to deal with this monster that is the informal sector. More than 70% of the population work in this sector, unregulated, not paying taxes, not receiving benefits much of the time. And so there's the government is limited in what it can do with a system which has huge structural problems, which predate, I mean, which go back for decades in many cases. So we're talking about weak institutions. I mean, what for example, the finance minister, María Antonieta Alva, has done. She's been described, by America's Quarterly, for example, as a millennial finance minister. She has a social conscience. She's trying to bring about reforms in trying to increase formality, trying to put more investment into education and health. But she also has limitations based on the government and the structure which she's working with. I think a good example of this is, they released the biggest financial rescue package in Latin America as a result of this pandemic. 12% of GDP, 19 billion soles, $26 billion. And a large part of that is going to be dedicated as payments to the poorest members of Peruvian society. There's something like 7 million payments have to be made to families. But of course, it's been very difficult to do that just because of the structural problems. Only half of those payments, approximately out of 6.8 million, there's something like 3.4 million payments which have actually been made. And these people are clearly desperate. They need this money. But there are, of course, problems, structural problems, which go back a long way. For example, only 4 in 10 adults in Peru are within the banking system. So how do you make these payments? If you have to literally go and take it to their homes. What if these people have been the people who are migrating from Lima back to their hometowns and rural hometowns, which we saw last month? And how do you track these people down? I mean, it's not like many of them have postal codes like in Canada or the United States. So it's an extremely complex problem, and you can obviously criticize the government for bureaucratic slowness in trying to reactivate the economy and trying to deal with these social problems, but they are dealing with the system which, for the dynamic formal economy, has made Peru one of the economic stars of Latin America. But for this huge informal economy, people are working with, I think Eduardo mentioned, this kind of antiquated post-colonial bureaucratic system, which is slow, it's extremely time-consuming, and so trying to transform that into all of a sudden a sort of dynamic bureaucratic system where everything works is simply impossible, I would say. I think that Peru, I hope that when this ends, whenever it does, that the lessons will be learned, and I think these have been points made by other panelists, that the lessons will be learned about the importance of public investment, which has been historically very weak in Peru. So obviously, clearly, the recent governments, including this government, have invested more, even doubled or tripled investment in the healthcare sector, in the education sector, but it's still among the lowest in the region in terms of investment, in terms of points of GDP in those sectors. So clearly more hopefully will inevitably need to be invested, or it'll be absolutely fundamental for this country to invest more in health as a result of this pandemic, more in education, so people are better able to understand these quarantine rules. And that's perhaps just one point in favor of having better education system, and better labor rights. And I think the private sector in Peru has to play a role in this, because obviously they've been able to increase profits as a result of having a very flexible labor market and a system which has not prioritized labor rights for much of the population. That's why these people are living in such precarious situations. So I think we have to take a sort of more holistic view of this, and I hope that something good comes out of it. And I think we have to be sympathetic with the government in that they're trying to do what they can. Of course, there are mistakes, and they probably have, there will be more mistakes during the rest of this period, but I think they're trying to do what they can with a system which is dysfunctional.
Thank you very much, Dan. Patricia, I'm going to ask you just in 2 minutes or 3 minutes, I'm going to give you the last word. I come from a medical family, so I always give the last word to the medical professionals. There was so many things that you might comment on, even just the last hope that Dan mentioned about whether this will raise a conciencia of having to in the future, giving much greater emphasis and investment in public health, which is obviously something near and dear to your heart. But that's just one of the themes that have come up. Do you have any closing comments that you want to give before we close the session? Patricia, you have to unmute. You made a...
We all made the same mistake with the mute. Okay, so I think the story has not ended. I mean, we will see what happens in the next month, really. But I really hope, as Dan said, that we get some good lessons from all this experience, okay? We will need more investment in health, in education. But one of the important things I think that we are seeing is that we need to simplify our processes in the government and be less bureaucratic. I think we have created a bureaucracy to try to fight against corruption, because, I mean, that's one of the biggest issues that we have, but it's not helping either with corruption or to have responses at the... The other thing is, I think we will need to work very hard on social communication, because this is a huge issue. It has to do definitely with education, people, but also, I mean, we need to make people understand, I mean, the importance of the rules, social distancing, and all those things. And we haven't discussed another issue, which for me is a big problem right now. Okay, we are also taking certain actions, especially in the medical area, that have no evidence, and I think may cause more problem than solutions. So right now, for example, the government is starting to talk about the distribution of medications, door by door to people, medications that do not have any proven action against COVID. Okay, but it's an interesting thing, because on one hand, they're trying to do actions that other countries like Brazil with Bolsonaro, okay, those packets for treatment. But on the other hand, as Peru, we're also participating in mega trials to try to find the most promising treatments. So I mean, there are things that I still don't understand, but I hope that we will come out well from this. I hope for the good that we will learn, and maybe we will have another and we'll have in Peru.
Thank you, Patricia. I think we lost you a little bit. There we got it. I mean, I think one of the positive notes then is whatever the government has done, it has at least not recommended drinking bleach, right? I mean, so it hasn't gotten to that point. And I assume not hydrochloroquine either. I think we've lost Patricia. So it's the time has come to end anyway. Thank you all and all the panelists for being with us today. Thank you for all of you who've been listening. A tape of this will be available on our website at ccacanada.com. This is certainly not the last event we're going to be doing on COVID in Latin America, on the ground, country by country. And it certainly won't be the last event we do with Peru. And we're hoping the next event we do with Peru, all of Eduardo's favorite Western movie stars will be riding on the range, and which will be an omen that everything is turning out way better than everybody hoped for, and hopefully sooner than everybody hoped for. So with that, thank you very much again, panelists. Thank you for all of you who've listened, and we hope to see you again soon. Thank you very much. Bye now.